This is Boomer Life on CL 650.
Can't you hear the pounding of my heartbeat? 'Cause you're the one I love. You're the one I love.
Can you hear my heartbeat? We're talking hearing on the program today. Can you tell? Little Hermits music there to kick off this segment of Boomer Life. Dr. Ted Venema is an audiologist with Next Gen and Mainland hearing centers all over British Columbia. Dr. Ted, you were talking about an audiologist, and then you mentioned another title of a person in the hearing profession. There's audiologists, and what was the other one?
Hearing instrument practitioners,
okay.
HIP.
What's the difference between the two?
One's like an optometrist, and the other one's like an optician.
Okay.
They're both in the same field. The scope of practice, an audiologist has a master's degree and is trained at a university. So an audiologist is not only fitting adults with hearing aids, but can also fit infants, babies. They do balance testing. They do more brainwave type of intraoperative monitoring in surgery. So audiologists have a bigger scope of practice.
Okay.
But the biggest element of it all is serving the adult public.
Sure.
And in that regard, the HIP does the same work as an audiologist. The HIP is a 2-year college diploma.
Okay.
And they are also trained to fit adult hearing, do adult hearing testing, adult hearing aid prescriptions, and adult hearing aid fittings.
Back in the day, you talked about the old plastic hearing aids where the technician would have to tweak it and tune it with a little screwdriver. So how frequently, and I'm jumping ahead of myself because I want you to talk about all the ears, but when you get a new hearing aid, how frequently back in the old analog days did you have to have it tuned up versus how does that work now with digital technology?
The follow-up visiting hasn't really changed that much.
Okay.
It's just that in follow-up visits, there's more that we can play with now than we could. Okay? But hearing aids and people have long been known to mix like oil and water. I mean, and it's because of the nature of damage to the end organ of hearing compared to that of the eye. As we said before the break, the eyeball is usually too long or too short, and a refocusing of light does the job.
Yeah.
Hearing aids, it's not that simple. Hearing aids have to make sounds louder, of course, but they're sending it to a damaged end organ. The retina, in quotes, of the ear, itself has some damage.
Right.
And that's why that's why I like the name hearing aid. It's like a cane for a bad knee. It helps, but it doesn't replace the real McCoy.
Right.
And that's what people need to be shown. They need that explained.
Right.
Because I think the limitations of hearing aids, if they're clearly explained, then the person walks out with realistic expectations.
Right.
And when you've got realistic expectations, that's golden. If you don't, you're going to be perennially dissatisfied.
So what would a realistic expectation be for a boomer who's going through this this age-induced hearing loss, the unavoidable type of hearing loss, and they decide, well, okay, then I'm gonna go take the plunge here. I'm gonna get a hearing test, and if they tell me I need some assistance, then I'm gonna get the hearing aids.
Well, the good thing is that it's free.
Right. The hearing test is absolutely free. Right.
The trial of a hearing aid is free for the first 30 days, or I should say 21 days, first 3 weeks. You don't put a nickel down, nothing. And then if you've committed to buying them, you still have an additional over 2 months to try them. In total, you've got 3 months of a trial period with a set of hearing aids that you can return for a full refund.
Right.
I mean, that's just normal policy at Mainland and Next Gen Hearing. So, in other words, you've got nothing to lose. And guess what? I'm not in sales. I'm a prof.
Right.
I used to run a shop with Next Gen. I don't do that anymore. I'd rather talk about it. But as one can tell. But it's what you can do about hearing loss is try hearing aids.
Right. So I think in terms of reasonable expectations, so my question was, it's reasonable to expect upon a hearing test, discovering some deficiencies and taking on the remedy, which is a hearing aid. It's reasonable to expect to hear better, but it's not reasonable to expect to hear perfectly.
Exactly. You're not going to get your hearing back that you had when you were 10.
Okay.
Sorry.
Right.
And that's the truth. So instead of the glass being half empty, let's make it half full. what we can do is tell you what hearing aids can do, and they will help. They'd help anyone with hearing loss. It's just you will be back to see us because you're going to have questions.
Right.
And we see people shoot after a week. You'll see you again after 2 weeks. You see again after maybe 3 weeks.
And this is just fine-tuning.
Yeah, normal, just to answer questions. Maybe we tweak things here or there, but basically all hearing aids are measured as to what they're doing on your ear. We don't just sit there and say, how does that sound?
Right.
Okay. We physically measure the sound coming out of the hearing aid to make sure it's appropriate for the specific degree of hearing loss you have across bass, mids, and treble pitches.
Right,
so everybody's hearing is different, and that's why hearing aids, like glasses, take a prescription.
Right.
Okay.
Okay, now let's move on to the part that everyone shares.
Absolutely.
If everyone's hearing is different,
yep,
everyone's ears aren't. We're all the same.
We have all generally have an outer, a middle, and an inner ear.
Okay, and that's the same for both sexes. There are no differences in that regard at all.
Nope.
Okay.
So you've got as we all learned in school, you have the outer ear, the middle ear, and the inner ear. And it's really kind of cool because the ear changes sound into mechanical piston energy, and that energy is again changed into electricity, and electricity is the language your brain understands.
Okay.
Just like the eye, the opening, the pupil of the eye lets light in, and the back of the eye, the retina, changes light into electricity.
Okay, so your brain can understand.
Yeah, so the ear has two changes. It changes sound into mechanics and then mechanics into electricity, and it's really cool how that is all done. The outer ear is the biggest and the most useless part of your ear. Okay, it's great to hook glasses around and hang earrings, but look at the shape of it. It has these weird bumps.
Yeah.
Why are our outer ears so strange looking? And the answer is because they have to be. Like a wine glass at Christmas that resonates when you lick your finger and you...
And it makes a tone, right, okay. Yeah.
Your outer ear has the bumps and ridges it has in order to resonate with high-pitched consonants sound. So your outer ear, the length of its ear canal, about 1 inch, 2.5 centimeters, and the weird bumps and ridges and folds is made that way, or we evolved that way because we speak.
So they're noise-gathering ridges and bumps and bulges.
And they emphasize the high pitches of speech, which are normally the softest.
Okay.
If I say the word thought, that word thought, the loudest part is the ah coming from my throat.
And I did.
The softest part is
to be honest with you, and I have a headset on, friends. I couldn't tell whether he was saying fought, as in we fought badly, or I thought something else. I missed the TH or an F sound.
Exactly, and those are high-pitched sounds. So your outer ear naturally elevates those. It adds about 20 decibels to the loudness of those high-pitched sounds.
Okay.
Chances are, if we didn't speak, we'd have dog or cat's ears. But because we speak, our ears have the shape they do.
Let me ask you a dog question, okay? Just
Yeah,
one.
go
Just
for it.
one. Because there are sounds, and you can buy some kind of whistle.
Dog whistle, yeah.
And apparently, and you can puff on it until you're red in the face,
you
and you don't hear a sound.
No.
And every dog in the neighborhood coming around looking for a hot dog or something.
Yeah.
So what is that? What is the...
They have better high-pitched hearing.
So it's just a pitch thing.
It's a pitch thing, and they need that for environmental sounds. Dogs use their ears for different reasons that we use our
Sure,
ears.
of course. Okay.
Our ears are used almost exclusively for communication with speech.
All right.
Yep, they warn us a bit about something scary coming up behind us, but we've evolved, or with our natures as human beings, we communicate. Our ancestors held onto the branches of trees while talking to each other. With both hands, they didn't need to signal. They could just yakety-yakety-yak and communicate complicated messages.
Right, okay.
You know, speech is a really wild thing, and that's why your outer ear has the shape that it does.
Okay, that's interesting because, you know, I mean, we all think of Prince Charles, of course, when we think of the classic outer ear. Barack Obama's not too far behind in that department either, is he? But, you know, big ears.
Yeah.
I mean, but that's just all.
Did you know that all audiologists have large ears,
No,
too? No.
I didn't know that. So if that's the outer ear, the big obvious
That's right.
visual part, where does the middle ear begin?
At the eardrum. So your outer ear is about 2.5 centimeters, about an inch long, your ear canal.
Okay.
That's why you never jam anything down in there, by the way. But we can get to that later. But
all right.
The ends
and
of
I
the
do
eardrum.
have a question about
there
that
you
for
go.
you later.
All right. Now your eardrum. If you turn your pinky finger to you, so it's pointed at you, your eardrum is about as big as the circumference of the tip of your little finger looking at you.
Right.
Okay? And that's your eardrum it's called the tympanic membrane, tympanum for drum.
Mm-hmm.
It's tight. It's a layer of skin that's tight, and behind that eardrum is a little chamber about the size of a sugar cube, and that's called your middle ear.
Okay.
Now your middle ear is just
the
filled with
eardrum,
air.
the eardrum to the out is the outer ear. So the middle ear starts on
At
the other side of the eardrum.
Correct.
Gotcha.
Yeah.
Okay.
And that little sugar cube's room, it's an air-filled room, and it connects to the outside by way of what they call the eustachian tubes going down to your throat.
Right, right.
And that's why when you're driving up a mountain, you swallow to make your ear pressure right, okay, because your middle ear will have different pressure than the outer area around.
We experience it flying it too, right?
So if you blow your nose real hard and plug, you blow real hard while plugging your nose, you'll feel it in your ears.
Right.
So your middle ear does communicate with the outside world through that tube that goes down to the back of your throat.
Okay.
One for each ear. Now, the middle ear has 3 little bones, the 3 smallest bones of the body. The biggest is your femur or thigh bone. The smallest is the hammer, the anvil, and the stirrup.
So the smallest bones in any human's body are in
ear
his
bones.
or her ears.
Yep. You can fit them all on a U.S. penny.
And you thought you weren't going to learn anything listening to the radio today. Ha ha! Boy, are you in for a good ride with us. So that's interesting. I did not know that.
Yep.
I knew the thing about the femur as being the largest.
The smallest are the ear bones.
You see, if you had asked me that question, I wouldn't have gone anywhere near the ear.
Well, there you go. And those tiny little bones have a purpose too, because when sound hits the drum of the eardrum, then that eardrum wiggles those little bones, and that's now sound waves have been changed into a mechanical piston-like energy. And those 3 little bones are used to activate the inner ear. But the outer ear also, the middle ear also has a second purpose, a very important purpose. You see, the inner ear is filled with fluid.
Okay.
Now, airborne sound bounces off of fluid. If you had your head under a swimming pool and I was talking to you from the outside of the pool, you're not going to hear me.
Right.
Because all my sound's going to bounce off the water.
Right.
Something has to help airborne sound puncture or penetrate or activate a fluid-filled inner ear. And that something is the middle ear. Do this little test with yourself once. You take your hand and push it against the side of your face real hard. You push with all your might. Now stop. Now with the same force, do that again on your fingertip. And it hurts, doesn't it?
It does, yeah.
Pressure is force over an area. Sound hits your big eardrum, and all that force gets converged onto the tiny last little stirrup bone of the 3 middle ear bones. The hammer, the anvil, and the stirrup. And the smallest of these is the stirrup. So sound hits a big eardrum area,
right,
and that force gets converged onto a small little pinpoint. This like bike tires have more pressure than car tires do, big air tires.
Right.
The thin little things. So the purpose of that middle ear is to increase the sound pressure so that it can activate a fluid-filled inner ear.
Okay.
Because all sound comes through the air, but it's got to somehow activate fluid. It's got to get in there.
Okay. Now, we need to take a break, and I hate to stop in the middle of
hey, go for
we're
it.
only in the middle of the middle ear, for crying out loud. but Dwayne's going to have a canary if we don't
take a
commercial break
all
here.
Right.
But I did want to very quickly ask you, just before we go to break, about the eardrum. I've never had it happen to me, but I know a person who had a ruptured eardrum, and he told me it's the most painful thing he's ever experienced in his life.
Well, ask anyone what earaches feel like.
I had those when I was a little kid.
Well, they hurt. Anything with the ear hurts.
So when for however it happens, when an eardrum is ruptured, do you immediately lose your ability to hear, or can that be repaired?
If it's a pinhole puncture, it'll heal by itself.
Okay.
If it's larger than that, a surgeon can do plastic surgery, take a piece of skin and put it over.
Okay.
Sometimes they lay a piece of cigarette paper over top of the hole, and the skin will grow like a scrim across that.
For crying out loud.
Yeah, weird, eh?
I got zigzag ears.
Yeah. I want Vogue.
This is Boomer Life on CIL 650. We're talking with Next Gen and Mainland Hearing's Dr. Ted Venema, and we'll be right back after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.